Super. Okay. So again, welcome to the Trauma-Informed Care and Support Programs webinar regarding displaced populations. Today is Thursday, July 21st, 2022. And I'm really happy to introduce two amazing speakers on this topic. So I'm going to first introduce Shivangi Gaur, who's the program coordinator at Punjabi Community Health Services. And she manages the program called Building Capacity to Address Newcomers' Mental Health and Trauma, and where the aim is to bridge settlement, social, and health sectors across Southern Ontario by building capacity of frontline staff. And Shivangi is a registered social worker with a bachelor's degree from Toronto Metropolitan University, formerly Ryerson. And she's not only worked in settlement, but also as a frontline geriatric social worker and case manager for those facing mental health concerns and survivors of domestic violence. And so she has extensive experience and speaks 4 languages and is a strong advocate and works with that trauma-informed lens when working with clients. So I'm going to turn it to her, and then I'm going to introduce our next speaker after that.
Thank you so much for the introduction, Jessica. Hi, everybody. It's so nice to see everybody this morning. I'm going to go ahead and share my screen, and then we'll get right into it. Perfect. So good morning, everybody, and welcome to today's talk. My talk today will be mainly about what we're doing in Peel and Halton region, as well as the other 7 regions that come under the jurisdiction of this program, and specifically about the trauma-informed care for newcomers and why it's needed, and kind of how this project began under the needs that were discovered over the last couple of years. So once again, my name is Shivangi, and I am the program coordinator at Punjabi Community Health Services, better known as PCHS. And we are a nonprofit organization located in the Peel region in Ontario. So just to start off, I would like to start off with a land acknowledgement. So PCHS is again situated in Peel region, so which is the traditional territories of the Mississaugas of the Credit First Nation and the territories of Treaty 13A, 14, and 19. We acknowledge the Mississaugas of the Credit First Nation on whose ancestral and treaty lands we work. We are all treaty people. As a result, we all have a responsibility to learn from Indigenous people on how to care for the land. We make this acknowledgement as one demonstration of our commitment to truth and reconciliation. We honor the Indigenous people who came before us and the continuous Indigenous presence on this traditional territory on which we work and learn. We are grateful to have the opportunity to work on this land, and by doing so, give our respect to its first inhabitants. When I speak about the land acknowledgement, I do also like to speak about my own acknowledgement towards truth and reconciliation, and that is that I am a daughter of settlers. So it is important for us as not only as individuals, but also as service providers to acknowledge the land on which we live, on which we migrate to, and share with Indigenous communities. And it's crucial for us to stand in allyship with our Indigenous communities so that we are all collectively able to take care of the land that we call home. We do also follow the Indigenous Knowledge Wheel at PCHS, and we'll touch base a little bit more about it later on as to how this project kind of began. And kind of the main values behind it is that being very holistic in nature. It's important to understand that the Indigenous knowledge as a term is a set of complex knowledge systems that are based on the worldviews of Indigenous communities. And that includes unique cultures, languages, governance, systems, and histories, which can only be taught by Indigenous elders, but it also is very prevalent in a lot of our communities as well. So understanding the knowledge wheel kind of goes into our holistic approach that we take at PCHS. So we'll be coming back to this concept quite a lot later on in the presentation. So just providing acknowledgement to begin with should be evident there. So my presentation today will kind of go a little bit quicker. We're just going to go into depth about how the program began, but I'm going to start a little bit with the history piece. So of course, knowing the history, we need to understand where we kind of began, where the project began, as well as how this project became such a niche in the sector. So as folks know, immigration, apart from the last 2 years, we would have expected it to be different, but in reality, in the first year of the pandemic, although there was a little bit of a dip of folks coming to Canada, the immigration numbers are back to increasing rapidly. There has also been a plan that was launched from, I think, for the next 3 years that outlined the number of newcomers to help rebuild our economy post-pandemic. And the target numbers are more than 400,000. So our sector is growing, and we've seen that. Now, the thing is that we need to ensure that our sector has the capacity to fulfill the folks that are coming to Canada. And that kind of touches base to the healthy immigrant effect. This is a phenomenon that states that immigrants are healthier than their Canadian counterparts upon arrival to Canada. However, their health steadily declines once they settle here. There is a level of concern of this as it indicates that immigration has long-term effects that need to be recognized. And some of those long-term effects, or some of those reasons, I guess, in trauma in immigration can be that the immigration experience itself is very scary. People leave their friends, their families, social systems, financial security, and societal supports in order to start their life elsewhere. And a lot of the times folks come with their families, with their kids, and there's a great deal of anxiousness there. The next piece is fleeing war-torn countries or abuse, neglect, and that's what we've seen all throughout this year with folks that were migrating here from Afghanistan, Syria, Yemen, and Ukraine. There is a huge, harsh reality of people who need to flee the only place they've ever called home in order to ensure their safety, their family's safety. And then the third is the cultural barriers. There's always a little bit of a transition. For some folks, it's a huge transition because they don't speak the language. They aren't aware of the cultural beliefs in society. I feel like even us folks who may have been born here or may have been living here from a very young age, we don't even know what the cultural beliefs are because it's so multicultural. There's so many different things. No matter what neighborhood you go to, no matter what folks you kind of interact with, you never know what their own cultural beliefs are. So there's no one way to kind of frame it in that, and that it's nerve-wracking, right? If you don't know how to act, you don't know how to make friends. So the immigration experience can have very long-term lasting effects. And these are all things, and then mental health in newcomers. So 91% of newcomers reported having experienced anxiety. And this was a StatsCan statistic. And it was done for folks who were in the country for, I believe, less than 3 years. So for folks who might not know what untreated mental health can kind of lead to, if you're dealing with anxiety, depression, any sort of untreated mental health illnesses, even from before your immigration experience, it can lead to a lot of devastating effects later on in your life, such as unnecessary disability, substance abuse, poor quality of life, unemployment, and homelessness. And the thing is that not only do we see this in our clients, but we also see this in our service providers and in our frontline settlement workers. And that's where this project kind of began. We started seeing these impacts of untreated mental health conditions to burnout in our staff, to burnout in our sector, because they were taking this trauma home with them, right? And as well as they had their own trauma that they weren't able to deal with, and they weren't able to find out why maybe some of their clients aren't progressing to the next stage of their journey in immigration, or they might not be able to find a job, keep a job, be that support for that they may need in their immigration journey. So this is where all of our pieces kind of started to come together. And of course, during COVID-19 pandemic, there was a great deal of burnout. So not only did it cause an additional layer of transitional stress, but it was also devastating for everybody who's working in the settlement sector because our jobs did not stop. We were all still working from home. We were still all dealing with this uncertainty of what this new life was, and trying to figure it out and navigate it every day. And plus we were providing this emotional and emotional support to our clients. So if there was a great deal of burnout, a great deal of mental health concerns that came up through the pandemic, specifically for working individuals who are in helping professions. So through this, of course, this project or this program has been around since before the pandemic. It actually started in June of 2020, which was the beginning of the pandemic. So I like to, it's funny, but I like to refer to this project as my pandemic baby. So this is all about this. So just to give a little bit of background about PCHS for folks who may not know, PCHS is a nonprofit organization accredited by CARF, which is the Commission on Accreditation Rehabilitation Facilities, and a charitable organization that was founded in 1990. PCHS's mandate is to provide health, settlement, and social services to improve the quality of life of individuals, families, and diverse communities. So PCHS is receiving settlement funding through IRCC since 2011 to serve newcomers settling in Brampton and Malton for the most part. PCHS has been using the settlement and health integrated service delivery model since 2011, which means that not only do our settlement workers provide settlement services, but they also provide referrals in-house as needed, because we do have mental health, addictions, geriatric services, all under the same umbrella. The settlement staff work closely with their health and social services staff to provide a basket of services to newcomer clients using the holistic service delivery model, which is something that we've used for a very long time at PCHS. So over the last 8 years, the model has evolved into the settlement multi-service hub model. And this experience has built PCHS's capacity to better understand the role of mental health and trauma-informed services and cultural competency when working with newcomers settling in Canada. PCHS has also made significant contributions to the capacity building of settlement and other human services sectors through trainings, workshops, forums on mental health first aid, cultural competency, domestic violence, 2S LGBTQ+ sensitivity, and dealing with difficult clients. Through this framework, we have delivered sessions on mental health well-being in the English language training classes conducted by the center, which is in Burlington, and as well as the Halton District School Board in Burlington and Oakville. PCHS's mental health program has been in existence since 2008 and currently comprises of a team of, I believe, 5 or 6 folks. The resource and expertise is leveraged to seek guidance on trainings used to mental health first aid and trauma-informed services in-house. PCHS was also funded by IRCC in March of 2018 to conduct a 2-day settlement crisis workers conference, which I know a lot of the folks that are here today were in attendance of that, because I always hear about that when folks hear about my project. And that was actually the conference that started off this project, and where the proposal and the thought of the building capacity to address newcomers' mental health and trauma program even came out. So that is the name of our project. And so just to give you a little bit of information about the project, it is a 5-year pilot project with a plan to ensure sustainability once it comes to an end. So I believe the ending is March of 2025. It's an IRCC add-on project to build capacity of frontline settlement staff in IRCC specific roles across 9 regions. And I'll show you the map after to kind of give a little bit of like a visual to where we're situated. And the main reason for this program is I work with frontline settlement staff to bring them a whole range of trainings to better build their capacity to not only take care of their clients, but also to take better care of themselves, to reduce that burnout, and to kind of identify service gaps and trends in the settlement sector so that we can report back to IRCC to say that, hey, you know, folks are really burnt out in this area specifically. Maybe we could use, or maybe we can recommend more trainings, or maybe we can recommend more funding, or whatever we can do in the realm of this project to kind of put a good word out there. It's always good to have more than one voice if you can, and that's the best piece about this project, because we get to see everything from an outsider kind of lens. And then of course to network and build relationships with other organizations and to ensure success. And the hope at the end of the day, of course, is to grow the program nationally, because there definitely is a need that we've seen, especially with folks who have been part of the trainings. You know that the capacity is so necessary. We need it to be there. and we're working on it, which is the great thing. So we are in the process of forming a network of trainers across the 9 identified local immigration partnerships, and we're providing a train the trainer training in mental health, first aid, and compassion fatigue. But one of the other main ones that we are doing is the trauma-informed service delivery approach, which our other speaker will be speaking about later on. Not gonna throw many hints out there. So these are the regions that we serve. Peel and Halton, of course, that's where most of our folks are from today, but then we have 9 local immigration partnerships in total. So the first leg of the project, which has been completed during the first quarter of fiscal year 2022, we did actually complete all of our compassion fatigue training that was needed, but that doesn't mean that our training stops now. We will continue to bring the training to staff. So if folks would like to bring this to their IRCC funded staff, please feel free to reach out to me after the session, and we can definitely get it situated for you folks. But through this, we were able to complete this all throughout the course of the pandemic while folks were still working from home. Now for next steps, this is kind of where we are speaking about today. Now you got all the history of what we've done until now and what we're planning to do from here. So of course we are working on mental health first aid, and the frontline settlement staff from settlement service organizations across the 9 local immigration partnerships will receive the mental health first aid training through a train the trainer approach, which means that there will be a network from recruited staff across the 9 regions who will kind of be our network leaders, I guess you can say, who will be trained in this approach. And then they will then provide this training to their own staff in their regions or other regions as specified. The 2-day training after the fact of the mental health first aid will result in the following outcomes, which will ensure that the direct service delivery staff are better equipped to understand the mental health needs of newcomers and also be able to make the most appropriate referrals to the various mental health resources that are available in their respective communities and their respective local immigration partnerships. This project will also provide training on trauma-informed service delivery approach to the frontline settlement staff by partnering with other organizations. CCVT is one of them, and we have them here today. The traumatic life experiences could pose a barrier in successful settlement and integration of newcomers and refugees. So using a trauma-informed approach in service delivery helps address this barrier. It enables staff and organizations to have a more compassionate and holistic approach in providing effective support and building sustainable services. The training will enable settlement staff to not only have a better understanding of the prevalence and impact of trauma on individuals, communities, and organizations, but they will also list guiding principles for incorporating a trauma-informed approach when working with newcomers, describe steps for creating safer work settings for not only clients, but service providers as well, and design an action plan for trauma-informed goals in service delivery and program planning. Lastly, our last training that we are going to provide is cultural competence approach. I'm not a huge fan of the cultural competency word, but that's how I guess it's named, but kind of just to provide, better, I guess, what's that word I'm looking for? Better competency when working with other cultures. I guess the word there is comfort, right? All of us, we don't want to say anything that's wrong. We don't want to overstep kind of our boundaries. So we want to ensure that we're comfortable and that our clients are comfortable working with us despite where our backgrounds may be. So at the end of the day, working from all of these from an anti-oppression, anti-racism, lens is very key, and that is the work that we do, and we ensure that our trainers are part of that as well. So our next moves are to continue building partnerships with the IRCC funded organizations across the 9 regions, as well as to bring their staff trauma-informed service delivery approach trainings by partnering with other organizations to provide this training based on what region you're situated in, as well as to provide a self-care guide for staff so that they're able to take care of themselves. Now, post the program, and as to what we're hoping to find after the fact, is that we want to ensure that our direct service delivery staff, which is our frontline settlement workers, are better equipped to not only deal with their own mental health and deal with their own burnout, but also better deal with their clients and be able to refer them wherever it's needed. And the hope is also, as we spoke about earlier, about sustainability, but also continue using the train the trainer trainings, as well as the partnerships we are making with other folks for our trauma-informed service delivery approach trainings, as well as our 2S LGBTQ+ or cultural competency trainings, to continue those partnerships with those organizations so that even when our newer generation of settlement staff join the sector, they're still getting those same trainings that we're getting during this 5-year span. And the outcome from that is that communities continue to foster welcoming environments, and that frontline settlement staff and local immigration partnerships are still able to continue establishing those connections with other parts of Ontario, so that if one of my clients from Peel region decides to move to Peterborough, I'm able to easily pick up the phone and say, hey, you know what, this individual may need some extra support. I know you folks provide settlement services out there. Would you be able to take this person on? And leveraging those connections and leveraging those networks as you have them, because we don't even know what the evolving issues may arise. We don't know how things are going to keep changing. There's certain things we've seen in the last 2.5 years that we would have never even expected to happen. And we never know. So it's better to be overly prepared, I feel, or just enough prepared rather than not at all. So two of my main goals is that we see intersectoral growth. And the hope is to see a more unified system with settlement and health sectors. And the hope from this is that folks are able to come here and live a full life, be able to live and work in the sectors that not only that they've studied in and that they've worked in their home countries, but also be able to live a happy life away from mental and physical disabilities, and so that we can provide and be a better support to our clients that may have complex concerns. And then the second part is to support our frontline settlement staff. We've all witnessed what's kind of happened. We all know and we've all dealt with it in our own ways. But I feel that more than ever, we need to join in a community and be together and take care of one another. As important as it is now, it's going to continuously, we're going to see the long-term impacts of it. We're going to see the long-term impacts on our sector and how we all internalize it on our own. So we need to ensure that we have the skills to be able to take care of ourselves, and therefore the better that we are, we can take better care of our clients. So that is I tried to go through that a little bit quickly, and I hope I didn't go over time there, Jessica. But
no, that was perfect.
Perfect. So that is kind of like the brief overview of the project and how this became such a big thing, especially in Peel region, because that is where we're situated, but we grew it across the 9 regions. So we're as far out as Kingston, as far west as Brantford. So it's interesting to see how different the demographics in each region are, but how heavily needed these trainings are. So it's really interesting to be here, and I hope that provided some insight. If you have any other questions, please feel free to just reach me in the chat. But thank you, Jessica and Shreya, for letting me be here today.
Thank you, Shivangi. And I think you really dove into building capacity on a number of different levels. So thank you so much. And maybe just a quick question. If anyone, another organization who's not already involved would be interested, would they just reach out to you? And I think there's already a request for your contact information in the chat box.
Yes, definitely. I'll drop my contact information in the chat. Folks can always reach out to me. Even though we may not have spots for the train the trainer piece for compassion fatigue, we can definitely bring that training to your IRCC funded staff. But we are doing other trainings such as mental health first aid, trauma-informed service delivery approach training. So get in contact with me. I'll put my email there, and then we can always connect.
Perfect.
Thank you.
Great. We have time for questions at the end, but maybe I'll just ask, is there anyone who has maybe one question, and then we can move to the next? Anyone have a burning question to ask Shivangi? Okay, we can wait till the end. All right. So I'm really happy to introduce Mbalu Lumor, who is from the Canadian Centre for Victims of Torture. Also, I think Shivangi mentioned CCVT as their acronym. And Mbalu is the Senior Manager of Programs and Newcomer Services at CCVT and has over 20 years experience in the immigration and refugee sector. She has extensive experience working with survivors of torture, program management and design, evaluation, and research. She has conducted presentations and trainings locally, nationally, and internationally on various topics, including trauma-specific care, vicarious trauma, and resiliency. She's passionate about social justice, human rights, decolonization, and accountability by non-Indigenous racialized people. And she's the co-author of the article, The Politics of Allyship with Indigenous Peoples in the Canadian Refugee Serving Sector, which, Mbalu, if you have a link, it's definitely an article I'd be interested in reading as well. So I'm going to turn the mic over to Mbalu. Thank you so much for joining.
Good morning, everyone. Thank you, Jessica. Thank you, everyone, for joining us today. And it's a privilege to take 20 minutes of your time out of your busy schedule to share about some of the work that the center is doing. But before I begin, with gratitude, I acknowledge that I am on the traditional territory of many Indigenous nations. The area known as Takaranto has been taken care of by the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. It is now home to many Indigenous peoples. We acknowledge the current treaty holders, the Mississauga of the Credit First Nation. This territory is subject to the Dish with One Spoon, One Spoon Belt Covenant, an agreement to peacefully share care for the Great Lakes region. So I would like to acknowledge that we're all treaty people, including those of us who came here as settlers, as migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly as a result of the transatlantic slave trade. CCVT, not sure how many people have heard about us, but for folks who haven't heard about us, we have a very specific mandate. We are a nonprofit organization that works specifically with survivors of war, torture, crimes against humanity, and genocide. So in partnership with the community, the center supports survivors in the process of successful integration into the Canadian society, works for their protection, integrity, and raises awareness of the continuing effects of torture and war to the survivors and their families. So CCVT gives hope after horror. So our mandate is very specific in terms of direct service in mental health, but also public education, which is extremely important to the work that we do. Just a few facts before I go into the trauma-informed approach. With our center, for those who haven't heard about us, it was founded in 1977 by several doctors, lawyers, and social service professionals. So the center was second of such facility in the world. And first in North America. So our services adopts International Rehabilitation Council of Torture, IRCT, global standard on the rehabilitation of torture victims. So with that protocol, this is important to ensure that national standards of trauma-informed approach and ethical practice are in place, using rigorously trained clinical professionals and practitioners, and building on successful pre-existing experience gained throughout the pandemic and in conjunction with the community and best practice of the International Rehabilitation Council for Victims of Torture, which started since 1981. So CCVT is a lead member of the Canadian Network for Survivors of Torture and Trauma, and we've been a member since 1994. Which we launched again in 2018, and we're collaborating right now in developing an online national mental health database. So for the past 45 years, I would say approximately, we've assisted over 26,000 survivors from over 150 different countries. So trauma-informed approach. Well, I mean, a lot of us have been talking about trauma-informed approach. And trauma-informed approach can be implemented in any type of service, setting, or organization. And it's distinct from trauma-specific interventions or treatments that are designed specifically to address the consequences of trauma and to facilitate healing. So it's very important when we're talking about those two, when we talk about trauma-informed approach, we know the difference in terms of trauma-informed care and trauma-specific. In general, when we talk about trauma-informed approach, which most people are more familiar with, it reflects adherence to 6 principles that's important for us to remember, rather than a prescribed set of practices or procedures. So these principles may be generalizable across multiple types of settings, although the terminology and application may be setting or sector specific, but there are 6 main things, which is in terms of safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, cultural, historical, and gender issues. So these 6 key principles are very important when we talk about trauma-informed approach. From this perspective, it is critical to promote the linkage to recovery and resilience for those individuals and families impacted by trauma. Consistent with this definition of recovery, services supports are trauma-informed, build on the best evidence available, and consumer and family engagement, empowerment, and collaboration. So how does this work in practice, right? So this is CCVT's model when we talk about the mental health, right? We are, as I said, we specialize working with survivors of war, torture, crimes against humanity. So it's very trauma specific in terms of the way our services are developed. So it requires constant attention, caring, awareness, sensitivity, possibly a cultural change at an organizational level. So ongoing internal organizational assessment and quality improvement, as well as engagement with community stakeholders. So when you look here in terms of CCVT, everything is interconnected. So CCVT as an organization uses trauma-informed care, and we understand that the widespread impact of trauma and understands potential path for recovery. So we recognize the signs, the symptoms of trauma in clients, families, staff, and others involved, and responds by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. So here, there's the specialized services. So the mental health component, where we have specialized staff specialized in various areas. We have settlement counselors, we have settlement trauma counselors, and we have mental health counselors. And in those 3 categories, we also have counselors that specialize working with children and youth. So those are in terms of the counselors. And the health professional is also part of the mental health services that we provide. We have psychiatrists, in-house psychiatrists, psychologists, psychotherapists, and they're all in-house. And we also have the virtual services as well, thanks to COVID, which has made it very accessible to everyone. So now our services are not only accessed at the provincial level, but also we're receiving referrals across the country, which is one of our main goals. You can see, despite the specialized services here, it's also very important to work the mutual support groups. So we do have therapeutic sessions. So in addition to the services, direct services that's provided by our health professionals, we also have therapeutic sessions that can be gender specific and language specific as well. So they take, most of them usually take for a period for at least 12 weeks minimum at all of our locations. Public education has been something that we've doing, as I said, throughout the existence of CCVT, in addition to the direct service, with the arrival of the Chilean refugees, Somali refugees, with the Syrian refugees, Afghan, and right now we're having the Ukrainians who are displaced as well. We continue to provide professional development in terms of building capacity of various sectors, not only the private sponsors, but also service providers who are working within the sector, educational institutions as well, and various partners that we're working with, especially with the Syrians when they arrived. We did a lot of trainings with various community partners, TNO, with OCASI as well, in terms of trauma-informed approach. And for the past 3 years, we've been working on a national project. We just piloted a trauma-informed train the trainer that just wrapped up in February of this year, which was just focused in Ontario on trauma-informed care approach. So as of October of this year, we will be doing a national training, Train the Trainer. And with this project in itself, it has been built by various community leaders across the country from different provinces. We do have an advisory committee member who actually walked with us throughout the needs assessment, throughout the focus group to develop this manual. So it will be taking place as of September at a national level until March of 2023. Registrations are open right now, and it's I think it's 2 participants maximum per agency, because we just want to maximize to ensure that we get as many people and to limit it a little bit, but not more than 2 individuals per agency can attend that training. There's also the certificate course, which we have been doing for many years. Before it was just at the provincial level, but now it is at the national level. And that certificate course usually takes place from September until June. And this is where we actually tap into some of our medical professionals that we've been working with for many years, and community activists. And they actually come in and provide 2 to 3 hours training. There's a small fee of about, I think, $300, I believe, $300. But it is a certificate that individuals will get at the end of the training. So those are trainings that have been continuing, in addition to ongoing trainings that we do within the sector, not only at the local level, at the national level, but also at the international level. We are a member of the IRCT, as I mentioned earlier, right at the beginning, which means there are protocols, guidelines that we ensure are in the services that we provide to ensure that anyone who's accessing, who's a survivor of war, torture, crimes against humanity, that needs mental health services, they are supported and are provided the support that they need from medical professionals. So we cannot ignore, when you look at all the arrows, they're all connected. We have various partners, political action. We work with Amnesty International. We are a member of CCR, Canadian Council for Refugees, so which they actually help us in terms of doing some of that advocacy, not only at the local, but also at the national level. So all of our services focus on that community intervention, meaning that CCVT, we understand the essence of being real, right? So yes, there is the medical intervention, there is a behavioral intervention, but community approach makes a big difference in terms of making things real. And that's what people usually need. When you see people who have experienced trauma, torture, then that interpersonal experience, because they've lost their family members, they've lost their sense of belonging, right? So yes, the medical intervention, the clinical intervention is important, but at the end of the day, you want that one-to-one personal contact. And we can even see recently, as we're seeing many of our clients who are coming from Ukraine, a lot of them, they're accessing English conversation, mental health services, and that one-to-one befriending that they're requesting as well. So that one-to-one contact, and in our community engagement program, our volunteers are actually able to visit them at their home and actually help them navigate through the system. So yes, you can have professionals. We work 9 to 5, Monday to Saturday, but on a Sunday night or a Saturday evening, you need someone that you can talk to, someone that you can go have coffee with. So that community approach, it's so important, and it is very important to the healing. And that's what we keep on emphasizing, that it's so important that we don't forget about that and we undermine it, because it is therapeutic in itself. When we look at some of the support groups, even in terms of children, after school program that we have, recreational program, that's when children actually open up. That's when you start building trust with a family as well, because yes, they're trusting you with their children. Maybe they'll come, let's say, for a recreational activity, but at the end, you'll come and find out more details about the family, about some of the challenges that they're going through. So to have a holistic approach in terms of service delivery is very important to the work that we do. And also we are mindful, and we do know our commitment to the Indigenous communities. So for the past 2 years, we've been working with various institutions, Wilfrid Laurier and York University, to do a land-based teaching with our service users and our staff. We just wrapped it up at Hyde Park in May, but plan on extending this training to various stakeholders at the national level in September. But we know that when we talk about even settlement to who? Whose land are we on? So that's something that we should never forget. Yes, we're providing services, but settlement, it's questionable. So even the term itself shouldn't be used, because we are on a stolen land, to be precise. So terms like that in itself do not foster meaningful reconciliation with Indigenous people. So we do need to be mindful of just using that term itself. Maybe newcomer services might be an alternative, but settlement as a term, it's an area that we're trying to dismantle and to discourage the sector from using those terms. So that's it in terms of the services that we provide. In terms of Ukrainian, as I mentioned, those are the main services that they've been accessing is the mental health. Mental health has been a key, family services, and especially now with the summer requests to be connected to various recreational activities. And I'm not sure if folks sit at various tables, because we sit both at the local Ukrainian table, and we also sit at the national. Does anyone here in the group sit at any one of those Ukrainian tables? You can just put in the chat, so that way maybe we can make connections. Anyone? No? Okay. Well, do I say, is there anyone? I don't see it in the chat, no. So I think those tables are very important. And if we don't have something like that in Peel, maybe we need to start developing a space like that where we're actually able to exchange resources, because that's the main reason of having those platforms. Because at both tables, both at the provincial and the national level, we exchange resources. We also discuss some of the issues, the trends, and to receive support from one another. So if this is something that does not exist in the Peel region, maybe this is an area that we might want to develop to ensure that we're consistent in terms of supporting some of our newcomers who are coming into the country. And some of the resources, as you all know, Red Cross has been taking a lead in terms of providing support for the Ukrainian community. Okasi as well also has a lot of resources if you go to their website in terms of providing support for Ukrainian newcomers who are coming into the country. So we have 4 offices. 1 in Mississauga, 1 downtown, 2 in Scarborough. So even though we have those offices, our services are accessed at a national level. Some of the key areas, as I mentioned earlier, was mental health, not only in terms of providing counseling, but also documentation and treatment. Especially for survivors of torture who need some of this documentation to present at the refugee board hearing. This has been very helpful, and we've seen that supporting a lot of our clients in terms of receiving their immigration status. So that's it in terms of an overview of what we do. If anyone has any questions, you're more than welcome to ask or for any clarifications.
Thank you so much, Mbalu. It was wonderful to hear the history and some of the grounding of the trauma-informed approach, and really how you're adapting services to be digital and online, as well as you know, some of the one-on-one aspects too are really important. So thanks for providing that comprehensive view of all the services through CCVT. And just around your question, if there is a Ukrainian table, in Peel we do have a coordination table that's focused on the Ukrainians, but also the Afghan arrivals. And so they meet about bi-weekly, and you know, it'd be lovely to, you know, connect, since you're probably at other tables. That would be great to feed in to make sure that the Peel table is up to date.
Okay, absolutely. Yeah.
Mm-hmm. All right, so I'll open it up now for questions. If you'd like, you can raise your hand. Okay, we have a first question, and feel free to use the chat box as well. Natalia, do you want to go first?
Thank you, Jessica. Mablu, thank you so much for your presentation.
Mm-hmm.
I have two questions for you. The first one is how the referral process works. In the community health center I work, we have a lot of people dealing with trauma and ward witnesses.
Mm-hmm.
And I'm wondering how to, since you are mentioning that your services are Canada-wide, I'm wondering how the process to refer a client for mental health and counseling services works.
Mm-hmm.
And the second question is how you guys deal with language barriers. Specifically for this kind of services, people is usually looking for services on their own language. Obviously, interpretation is always available, but there is certain kind of rejection when people is not able to express their feelings completely in their own language or feel that they are really connecting. So I just also wanted to know about that, referral and language barriers. Thank you.
No problem. Thank you, Natalia. So the first question in terms of referrals, so referrals come from all over. So we get it from lawyers, from doctors, from hospitals, from schools, community partners. So there is a toll-free number, which I'm going to post. I'm just going to put the to-do list. So once I finish, I'll put it in the chat box. So there's a toll-free number that anyone can call across the country. And they can just provide name and phone number and we'll call them. You don't have to go into details. So that's for those who just want to use a phone. But also if you want to just make a referral, you can just go online on our website. There's a referral form where you can put just the name, phone number, the province that you're in. We want to know the province because we have various community partners. So we're working with various community services. So yes, there's specific services that we can provide for you, but it's also important for you to be connected to your local community agency. So yes, we'll provide the specific services, but also we'll be able to connect you with a local community agency that can continue to follow up. And in conjunction, we're all working collaboratively to support you. So that's very important in terms of a referral system. And that's why we ask for those specific questions. And in terms of referrals, not everyone, as I said, our services are very unique, right? So anyone that's referred to our center, there has to be an intake and assessment to see if you fit into the mandate. If you fit into the mandate, you can access any of our services. If you don't fit into the mandate, then we have various community partners because we get a lot of people dropping in at our center. So, and we are a community agency, so we will connect you to your local community agency or to the service that you need. So definitely in terms of information referral, it is still part of our the services that we provide. In terms of language, all of our counselors, if you go to our website, they speak multiple language, and that's one of the things that we've seen like in our many years of experience, especially when it comes to mental health. First language counseling is extremely important. Yes, interpreters are important. We have about 250 volunteers who help us out and they speak various languages and we use them when we need to use them. right? For maybe basic items, but if it's for ongoing counseling, it's extremely important that you have a counselor that speaks the first language of the client, which makes them feel very comfortable. So that option is always there, and we make sure that the client knows that, but also being mindful, some clients might not want to work with people from their same community, and we have to respect that, right? So yes, that service will be there, and that's for various reasons. It could be community stigma. So if they don't want to see someone, if they don't want to work with someone from their community, maybe we can just get someone from a different community that speaks that language. So we try to kind of moderate it as much as possible, and also being mindful that not everyone might want to be connected from their community due to the trauma, right? Because it can be from the same country, but various ethnic backgrounds. They speak the same language and there's still conflict within those countries. So being mindful of that and assessing that before you actually make those matches.
Mbalu, just a quick note. So war witnesses and victims of war are part of your mandate?
Yes, survivors of war, torture, crimes against humanity, and genocide, right? And for the past 2 years, we just launched a new program, which is our anti-human trafficking, right?
And
so
their families as well, the families of all those that Mbalu mentioned as well. They don't have to be specifically being, if it's, for example, a father, mother, a brother that lives in Canada for a long time and have lost 2 or 3 of his siblings in the war, and the other 2 or 3 come, because sometimes there are numerous families, and it is losses due to war. The family is included. And that's just an example. It could be many other things that affect the family, even if the family was not in the place of the war.
And that's what, when we look at trauma, and that's something that we usually talk a little bit more during the training in terms of direct trauma, indirect trauma, and social trauma, right? And Tress actually manages the anti-human trafficking project that we have at the center. So she's our program manager. And thank you for that input, Tressa. I hope I answered your question, Natalia. And I will be putting in the phone number and our website and the article on Indigenous people in the chat box. Perfect. But any other questions? Yeah.
Any other questions? And just a note that all those who registered through Eventbrite will receive the recording and other pieces. So if you haven't registered through Eventbrite, please be sure to leave your email in the chat box so that we can email you the follow-up materials. I'm going to go to Harpreet, and then there's a question in the chat box. Harpreet.
Thank you, Jessica. And I just want to say thanks to Shivangi and Mbalu for both of your presentations. And I have a question for Mbalu that what term do you suggest in terms of instead of using settlement? Because it comes up so often, so many times. Even if we say newcomer services, if we replace it with that, we still end up saying, we're helping them in their journey to settle, right? So what are your suggestions? What words or vocabulary do you use within your center instead of settlement?
When you look at my title, it says newcomer services, right? So we try to move away from that settlement manager, and that's something, it goes beyond just one agency. It goes beyond the sector. When you look at the history of the word settlement and you look deep into the Canadian history, you would see that the whole purpose of settlement was actually to take the land from Indigenous communities. So it doesn't have the best connotation. It doesn't have the best, it just makes it difficult in terms of building that healthy relationship with Indigenous people. So that's something that maybe we need to go beyond, because when we look at even our funding structure, how we're funded, it's funded under settlement, right? Settlement delivery, right? So it goes beyond our individual effort, but also for us to maybe bring it up with our funders And that's something for them to reimagine another name other than settlement.
Thank you. And I also want to share an experience, as you had mentioned that you work with the victims of war, torture, and genocide. I had a client a couple of years ago that I was working with. And so this is like, you know, some things we don't realize, things that will trigger trauma in our clients. And for my clients, for my client, who spoke a different language, and I was serving her, and I wanted to make sure that I was able to serve her in her first language and that we were able to understand each other. So we arranged for an interpreter, and interpreter came in the camouflaged clothing. And so we provided the service, we did everything, and afterwards, the mother of, because I was working in the school system, the mother came to me and said, I do not want that interpreter ever again. I'm gonna do my best to understand you. And I was completely lost at what was the reason. And she said she was wearing like military clothing, and she might tell about us. So that just really kind of like shook me, because I was like, wow, I never thought that the kind of clothes we wear or a piece of article that we wear or anyone in providing services might wear can trigger trauma. So I just wanted to share that experience because I found it very powerful. And keeping in mind for next time for our interpreters.
Very important. And that's why our community engagement does trainings. So not only sensitivity to working with survivors of torture who've experienced trauma, but also we have one of our physicians that comes on a yearly basis that does sensitivity training just for the interpreters, right? Because they're not all of them are professionally trained. These are community members just like you and I who speak various languages, and they're passionate and they want to give back, right? So we need to ensure that we're building their capacity and we're supporting them so that way they can continue supporting us. Because with us, for example, as I mentioned earlier, our agency started off with volunteers. So volunteers are really the heart of our agency, right? Without our volunteers, we don't exist because they provide various activities. Even recently, even with our citizenship classes, we're reimagining how citizenship classes would look like, starting from the perspective of Indigenous people, right? But this is done by volunteers. We have restrictions, we have funding deliverables, but with our volunteers, we can actually expand and actually be more human, right? And provide additional services to our service users. In terms of re-traumatization, it's very common, right? And that's why when I show the PowerPoint in terms of trauma-informed approach, that should be always at the back of our mind in terms of not re-traumatizing. And how does that take place? It's constant reflection. And that's why in one of our modules that we do in VT, the importance of reflection, right? Because sometimes, you know, we might interpret things in different, oh, well, they don't want to go to English class. Oh, yeah, because they're lazy, or they just want to stay home, right? But always reflection on an ongoing basis, looking at your own privilege, right? Why are you thinking this way, right? Where do you stand in the power pedal? You know, the power when we work on anti-oppression framework, right? Where's your privilege? So critically examining that will help in terms of providing some of the those re-traumatization. I remember years back when I first started at CCVT, I was managing, I was a child and youth counselor, and I had my keychain, right? I would have my keychain and I would be walking, walking in the office, but the keychain as you're walking, because I had it on my neck, it actually makes sounds, right? And that sound can be sort of a trigger in terms of the guard passing by the jail, by the cell, right? So I had to be reminded to actually be mindful of that keychain that I was walking with throughout during the class when the language classes were taking place, because there's some people, most of our clients who are detained, they have that can be a trigger for them, right? Remembering the guard who was coming by, and what reminded them was actually the keychain. right? So in situations like that, it's very important if someone is triggered is to have those conversations. Don't brush it down, but face it and have a conversation with them so that way they can understand it. Psychoeducation plays a key, and I feel like now I'm doing the training. This is supposed to be just an overview, but psychoeducation plays an important role, right? Right at the beginning when survivors arrive, but throughout their journey as they live in Canada, right? So that ongoing psychoeducation is important, but also that reflection for ourselves to see what did we do right today. It's very important for our own well-being as well, because when we talk about trauma-informed approach, it's not only that direct service, as my colleague Shivangi also mentioned, but also taking care of ourselves, right? We're part of that narrative. You cannot separate yourself from the service delivery. And for many years, it was actually the other way around. Being in the sector for a while, we always focused on direct service, so how can I best support this client? But how can you, if you can't take care of yourself, how can you take care of someone else, right? So being intentional and not only having individual self-care policies, but also organizational level, but also working with the community in general and within the sector to ensure that service providers are intentionally and the structures there to support their well-being so they can continue doing the work, especially with COVID. We've seen the challenges, right? That a lot of our service providers have experienced, which is a different story in terms of HR, and I'll save it for another day. But thank you so much. Those are great questions. Sorry, I just kept going. It felt like a training session.
Thank you for that. Appreciate it very much.
Mm-hmm.
Maybe to follow on that, I know someone was asking in the chat box in Mbalu about how to apply to be a volunteer at CCVT. But maybe just following this discussion, it would be great to touch on roles and scope of those roles, because with trauma, if you don't have the specialization, you might not want to pull on some of the threads, as I've heard from Polycultural, Nadia Sokan, the director there, that you just want to be aware of your role and not wanting to open things up if you're not necessarily have the capacity and the training and the specialization to undertake some of this work. So I wonder if you can speak about roles and how to make those referrals, as you mentioned, and or connect more to other agencies. Mm-hmm.
So first thing first, it's important for us to know that survivors are agents of their own recovery. Right? So if you say that you would like to be a volunteer, you're not there to change their lives, right? So that framework of I'm here to control, to help you out, to tell you what to do. Survivors require respect, just like any one of us. Right? So if you're volunteering, there's a role and you need to know your boundaries as well. And that's what the training is, because before anyone is connected to our service users, there's a mandatory training. There's a police clearance that we have to do. There's a reference check that we have to do. There's an interview that we have to do. So there are a lot of things that are put in place to ensure that the people that we're bringing in are actually in the same direction in terms of the work of the center. In addition, there's ongoing training that's provided throughout the year as well to ensure that the capacity of of volunteers are being built on. At the reception, volunteers are there, right? So they help with a lot of our bookings as well, answering phone calls. We have volunteers as well in the after-school program, right? Working with children, whether it's in field trips, whether it's one-to-one tutoring, whether it's in the youth mentorship program, volunteers are there. We have in our language instruction classes, in-person language instruction class, we have volunteers there. We understand that, yes, you can teach the language, right? You can be a teacher, but the unique needs for survivors. And it's important to ensure that all students are engaged in the classroom because people learn in a different way. So there are volunteers who work in small groups during the classroom. So the teacher will teach in general, but also will break down, have a breakout room in person, right? So they'll put them in smaller groups and work with volunteers. So again, they're connected to the community. That's what we're looking for. So it's not only, yes, academic, but also knowing that there are community members out there that care about you and care about your well-being. And for those who need additional support, they will be matched one-to-one with a volunteer as well to provide academic support. And then if it's just friendship, isolation has been a big one, and especially during the pandemic, we saw that our befriending program, which is one of our oldest volunteer program, there's a lot of requests for mentorship and befriending. So which means you're matched with a volunteer, and this volunteer becomes a friend. And we have people who've been befrienders for over 20 years. So they visit your home, you visit each other's home. The thing is, if we want to change the world, right? Going back to our two mandates, when I said service delivery, it's important. Look, not only at looking at the clinical components, right? But those human connections. We also need to make sure that we're lifetime learners. So which means the volunteer who has probably been in the country a little bit longer will be connected to a survivor who's new to the country, and they're exchanging. I learn from you, you learn from me. And that's how we get respect. And it doesn't show that you're better than me or I'm better than you. We're all here as human beings, and we're here to support one another. And that's how we change. And that's why public education is so important to the work that we do. Volunteers help us in our various events. We organize World Refugee Day, International Day in support of victims of torture. They help us out with donations. If we need a wheelchair, for example, we send an email to our volunteers and a client gets a wheelchair. If we need a service user to be escorted for a doctor's appointment, we can get a volunteer that can be there. Language, right? Interpretation, it's very important. Translation, volunteers do it. So practically all the services, even within the counseling sessions, volunteers are there in terms of providing interpretation, right? But again, they need to go through training before they start doing that. And even in the training itself, volunteers are being informed that you will be working with survivors. So there is that risk of vicarious trauma that we should never forget as well, right? So taking care of yourself, right? And also making sure that you know your boundaries, confidentiality are very key points to the work that we do as well, right? To avoid some of those re-triggering and re-traumatization to our service users. So if you go to our website, you will see community engagement, how to get involved. You can just fill up an application there. Then you can decide which location you would like to be a volunteer. Mississauga, Scarborough, downtown, it's up to you. But right now with our volunteers, since we're actually going the direction of national, volunteers can be from anywhere because we need them to support us in launching our national database.
Mbalu, can I please quickly ask you, you said survivors are agents of their own recovery.
Mm-hmm. Yes.
That's what you said, the statement, right?
Yeah.
I love that. I think it's quote worthy by Mbalu, because often we forget we need to help. We need to help others. But that is so important to acknowledge that, yes, they are their own agents. They know themselves and their journeys best. I love that.
Yeah, and for that, there's many people who've been before me. As I said, CCVT started in 1977. That quote comes from many years of experts who came before me. And our key staff that has been with us for many years is actually in the presence here, which I would like us to acknowledge, which is Teresa. As you can see her there, that's Teresa. Teresa has been with us for many, many, many years. I think sometimes we forget we appreciate people when they're no longer with us, right? But I think it's important that we appreciate people when they're still alive, and we acknowledge the skill, the talent, because things have changed, the resources, even within the sector. I remember when I first started, there's only one child youth council, but now there's about 4 or 5 child youth councils. So one council with like 35 or 40 children. At those days, under a church basement, Teresa was there providing services for those time, I think, Chileans and Somalis. So it is a privilege to always work with her. So just wanted to make sure I acknowledge that in front of everyone.
Thank you, Mbalu. The church basement was a blessing. I was actually inside the closet in a second floor in a house that doesn't exist anymore. And when I say inside the closet, I literally mean it. It was those roomy closets that they had. There was no room for any other desk. Anyway, that's history. And we have come a long way. Volunteers have done a lot of work. Staff does a lot of volunteer work. The network of doctors were one of the components and main founding members of the organizations that did tremendous and still do tremendous amount of work on voluntary basis, and even many times pro bono, because this coverage is at stake right now, the health coverage of refugees and newcomers. There is even one that it started as long ago as I started, that is promoting and having that. You saw that bubble in the model that Mbalu presented that said political action. He is leading together with other doctors as a letter to sign, and signed already by over 100 people, to stop the people that want to take away the health care for undocumented individuals. It is awful. There are many clinics that are providing it. There are not many, and they want to dismantle them. And that is going to be detrimental not only for the health of the newcomers, but for the health of everybody. If we don't take care of somebody that has COVID, everybody else will have COVID. So, sorry, it's not my turn.
No, please.
I did my fair share for 35 years, so I'm very proud of Mbalu as well. So, thank you.
Wonderful. Well, thank you so much. I know we're in the last minute, and there were so many wonderful thoughts and insights and resources shared. So we'll be collecting from Shivangi, Mbalu, Teresa, some of the pieces that they mentioned about trainings and other pieces, and we'll send that, group that into an email. So again, maybe Shreya will share her email in case you haven't had the chance to give your email to her. That way we can share that follow-up email with everybody. And I just want to thank everyone for joining. It was such a wonderful exchange and dialogue on this topic. And I know that it's something that we'll continue to talk about. Shivangi and Mbalu and perhaps Teresa as well. We're thinking about how we can dive into this in a more in-depth way. It's hard to do it in an hour and 15 minutes. So it was a great overview. So thank you again, everyone, for joining, and hope everyone has a wonderful day and lots of self-care wishes to all.